Hey everybody, welcome back to our discussion of the different classes of medication. This lesson focuses on the common types of drugs for the cardiovascular system, including the structure and function of the cardiovascular system, common cardiovascular disorders, and the use, administration, and precautions of various drug groups essential for treating cardiovascular diseases. Let's begin by defining the parts of the cardiovascular system. The cardiovascular system, also known as the circulatory system, includes the heart, blood vessels, and blood. This system is responsible for transporting oxygen, nutrients, and hormones to cells throughout the body and removing waste products. Blood has two components, plasma and cells. The plasma is a fluid made up of about 90% water, and within this water is a mixture of substances, many of which are proteins. There are three main types of cells found in the blood. Red blood cells, or erythrocytes, which transport oxygen from the lungs to the body's tissues, white blood cells, or leukocytes, which defend against infection, and platelets, which are involved in blood clotting. Common cardiovascular disorders include hypertension, coronary artery disease, heart failure, and arrhythmias. Symptoms often include chest pain or angina, shortness of breath or dyspnea, fatigue, and irregular heartbeats or arrhythmias. There are several different types of drugs used to treat cardiovascular disorders, such as adrenergics, vasodilators, diuretics, antihypertensives, calcium channel blockers, antilipemics, cardiac glycosides, antiarrhythmics, anticoagulants, antiplatelets, hemostatics, and hematinics. Let's look at how these drugs work to treat different cardiovascular diseases and some of the things you need to be aware of when treating patients with these medications. A number of cardiovascular drugs regulate blood pressure. Adrenergics increase blood pressure by causing the blood vessels to contract. Adrenergics are used to treat shock, heart block, and adverse drug reactions. Common examples of adrenergics are norepinephrine, marketed as Levophed, and phenylephrine, marketed as neosynephrine. Vasodilators have the opposite effect on blood pressure. These drugs relax the walls of the arteries, allowing blood to flow through them more easily, lowering blood pressure. Vasodilators are used to treat chest pain or angina. Common examples of vasodilators are sublingual nitroglycerin, marketed as Nitrostat, and isosorbide. If a patient is experiencing angina and nitroglycerin is ordered, administer 1 nitroglycerin sublingually. If angina continues after 5 minutes, check vital signs, especially blood pressure and pulse, and if the vital signs are stable, give a second dose. If after 5 minutes angina continues, a third dose may be administered. The patient would then need to be evaluated further depending on their code status. Diuretics also lower blood pressure, but they do so by helping the body get rid of excess fluid. Diuretics are used to treat congestive heart failure and hypertension. Common examples of diuretics are triamterene, marketed as Direnium, and furosemide, marketed as Lasix. Some thiazide diuretics, such as Lasix, can cause potassium loss, leading to hypokalemia. It's important to monitor for low potassium and encourage patients to eat foods high in potassium, such as bananas, orange juice, and other foods. Potassium can also be supplied by potassium replacement drugs, such as K-Dur, Chlorcon, and K-Tab. Antihypertensives target different aspects of the cardiovascular system, also lowering blood pressure. Antihypertensives are used to treat hypertension or high blood pressure. Common examples of antihypertensives are lisinopril, marketed as Zestril, and metoprolol tartrate, marketed as Lopressor. Another way to lower blood pressure is by relaxing the heart muscles and blood vessels, which can be done with calcium channel blockers. Calcium channel blockers are used to treat hypertension and angina. Common examples of calcium channel blockers are amlodipine, marketed as Norvasc, and nifedipine, marketed as Procardia. When administering calcium channel blockers, you should monitor a patient's response to therapy through blood pressure and pulse monitoring, and also observe for adverse effects such as hypotension and GI distress. We've covered a number of medications that affect blood pressure. Now, let's look at some types of medication that target other aspects of the cardiovascular system. Antilipemics lower blood cholesterol levels. Antilipemics are used to treat high blood cholesterol and other heart disease. Common examples of antilipemics are atorvastatin, marketed as Lipitor, and rosuvastatin, marketed as Crestor. Patient education on proper diet, including a low-fat diet, combined with monitoring lab results are often important parts of a treatment plan for patients with high cholesterol. Cardiac glycosides increase heart efficiency and force by improving the muscle tone of the myocardium, increasing the force of contraction and slowing the heart. Cardiac glycosides are used to treat congestive heart failure and arrhythmias. A common example of cardiac glycosides is digoxin, marketed as Lanoxin. Because cardiac glycosides impact heart rate, it is important to monitor apical pulse when administering Lanoxin and alert the appropriate staff if the patient's heart rate becomes too low. It is also important to monitor therapeutic lab values and digoxin toxicity. Antiarrhythmics help regulate the heartbeat by stabilizing the heart muscle so it does not flutter or beat too rapidly. Antiarrhythmics are used to treat atrial and ventricular dysrhythmias. Common examples of antiarrhythmics include quinidine and propranolol. Because antiarrhythmics impact heart rate, it's important to monitor a patient's apical pulse rate and rhythm before administering these medications. Anticoagulants prevent the blood from clotting. Anticoagulants are used to treat patients at risk for blood clots. Common examples of anticoagulants are warfarin, marketed as Coumadin, and rivaroxaban, marketed as Xarelto. There are risks associated with administration of anticoagulants, so it is important to monitor the lab values of a patient taking these medications and look for signs of bleeding, such as bruising, blood in the stool and urine, and bleeding gums. Antiplatelets suppress platelet aggregation and prevent blood clots. Antiplatelets are used to treat arterial thrombosis, deep vein thrombosis, stroke, or myocardial infarction. Common examples of antiplatelets are aspirin and clopidogrel, marketed as Plavix. Hemostatics have the opposite effect to anticoagulants and antiplatelets. They help the formation of blood clots. Common examples of hemostatics are phytonadione, marketed as Mephaton, and aminocaproic acid, marketed as Amicar. Hematinics are used to increase red blood cell counts. Hematinics are used to treat conditions like anemia. Common examples of hematinics are cyanobalamin and ferrous sulfate. Patients should be made aware that side effects of ferrous sulfate include black stool and the need to use a straw when consuming it in liquid form to avoid staining their teeth. Cardiovascular medications can be delivered either in an initial dose or a maintenance dose. The initial dose is the first dose and is often large to build up the level of the medication in the bloodstream. The maintenance doses are subsequent doses that maintain the level of the medication in the bloodstream without causing overdose. Each drug group has potential side effects, ranging from mild, such as nausea or dizziness, to severe, such as internal bleeding or arrhythmias. It's crucial to monitor patients taking cardiovascular medications for adverse reactions, as they may become life-threatening. When administering medications for cardiovascular disorders, it is especially important to pay attention to the route of administration. Some medications are administered orally, while others are administered sublingually. Oral medications are swallowed and absorbed more slowly through the stomach and intestines, while sublingual medications are placed under the tongue for rapid absorption into the bloodstream. As with all medication administration, you should perform proper hand hygiene and don appropriate PPE before administering medications for cardiovascular disorders. Additionally, you want to be sure to follow the rites of medication administration, ensuring the right patient, drug, dose, route, time, and documentation, with added precautions to avoid contaminating medication packages. In summary, the cardiovascular system is responsible for transporting oxygen and nutrients to the cells throughout the body and removing waste products. The cardiovascular system includes the heart, blood vessels, and blood. Common cardiovascular disorders include hypertension, coronary artery disease, heart failure, and arrhythmias. Symptoms often include chest pain or angina, shortness of breath or dyspnea, fatigue, and irregular heartbeats or arrhythmias. There are a wide variety of medications used to treat cardiovascular disorders. These include medications that regulate blood pressure, including adrenergics, vasodilators, diuretics, antihypertensives, and calcium channel blockers. Medications that regulate heart rate, including cardiac glycosides and antiarrhythmics. Medications that affect blood clotting, like anticoagulants, antiplatelets, and hemostatics. And other classes of medications, including antilipemics and hematinics. Monitoring patients on cardiovascular medications is crucial, as some side effects, like internal bleeding or arrhythmias, can be severe.